everybody. The March 26th, a meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Ansello, Ms. Andrews, Dr. Carbone, Mr. Daniele, Chairwoman Draw,
Here.
Ms. Cayley, Mr. Lightfoot, Dr. Quattro, Mrs. Valerio.
Is there anyone signed up for public forum?
There is not.
And at this time, is there anyone present that would like to speak? To address the committee? If not, seeing none. The next item on the agenda is the approval of minutes. You have before you the February 26 minutes. They'll stand approved unless the clerk is notified of any changes by the end of the day. And the next item on the agenda is new business. Madam Clerk.
Referral 13-91.
Moved by Legislator Quattro and seconded by Legislator Carbone. Is there any discussion on this? Legislator Andrews.
Thank you, Madam Chair. Through you, referral indicates the additional money will cover the cost of an increased number of samples. My question would be, through you.
We had problems last time. Yeah.
Additional samples do we anticipate being able to cover because of receiving this funding?
Through you, Madam Chair, we anticipate going from approximately 3,400 samples to 4,000 samples.
Great. Thank you very much.
Any other discussion? Legislator Cayley.
Madam Chair, through you to the administration. From the 3,400 to the 4,000 samples, since the levels have been going down, do you expect there to be any uptick at all, or do you expect the percentage to be about the same?
Through you, Madam Chair, these are environmental samples.
Okay.
I don't have a thought about what the trend would be with that, but we are doing more work than we thought.
Okay, thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-92.
Moved by Legislator Carbone and second by Legislator Valerio. Is there any discussion on this? Legislator Cayley.
Thank you. Through the chair to the administration, I wasn't sure when I was reading this. Are these vaccines used for all ages?
Through you, Madam Chair, yes, that's true.
Thank you. And is this funding the result of new health care legislation that's coming? Since we're referring to, through the chair, since we're referring to folks without insurance?
Through you, Madam Chair, no, this does not have really anything to do with new health care legislation.
Okay, thank you.
And this is just an increase in the amount of the Immunization Action Plan program, which was previously reviewed by the legislature.
Thank you.
Any other questions? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-93.
Moved by Legislator Valerio and seconded by Legislator Daniele. Is there any discussion on this? Legislator Cayley.
Thank you. Madam Chair, through you to the administration. Could you give me a little bit of an no, excuse me, let me back up and ask that differently. Are you aiming at peer counselors being located in as many locations as possible? Are these counselors traveling distances, or are they traveling within the areas that they live? Through the chair.
Through you, Madam Chair, I didn't hear the end. Could you just repeat the end of that?
It was convoluted, I'm sorry. Through the chair, the counselors are located, reside, since they're here, in a number of different zip codes. When you're using the peer counselors for this program, do you try to find counselors that are located in various zip codes, or does it not matter and they travel through the chair?
Through you, Madam Chair, yes, we try to find peer counselors that live in the areas where our WIC program sites are.
Thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-94.
Moved by legislator Daniele and second by legislator Ansello. Is there any discussion on this? Legislator Andrews.
I couldn't recall, is this the second year that we've received this grant?
Through you, Madam Chair, yes.
Through the chair, then, could you just talk a little bit about what you accomplished in the first year of the grant and what you expect to do in the second year?
I'm sorry, I wasn't able to understand what you were saying.
Through the chair, would you be able to talk a little bit about what you accomplished in the first year of the grant and what you expect to do with year 2? Thank you.
Through you, Madam Chair, we really got started very late in the year. For the first year, it was one of those things where the state awarded the funds late, and we got started late. So I don't really have a good explanation for what we found in the first year.
Through the chair, then, could you explain, now that you're up and running, what do you expect to do going forward with a little more specificity than what's in the referral?
Through you, Madam Chair, yes, there are sort of two major parts of the project. One part is to do increased testing in our STD program, and then in the other part, we contract with AIDS Care, and they have an outreach van, and they go out in the community and do HIV, Hep C, and STD testing in the community.
Thank you. And through the chair, is this targeted geographically? It's somewhere in the county?
Technically, the high-risk area is the city of Rochester for this particular grant. I know sometimes when we talk about projects, we talk about a more focused target area, but for this one, it's the city of Rochester.
Through the chair, Dr. Doniger.
Thank you.
Oh, I'm sorry.
Thank you.
Thanks.
Any other discussion? Legislator Lightfoot.
Through you, Madam Chairman, just to the administration, just a comment. I think I made this comment last year, too, when we were talking about this particular program, through you, Madam Chairman, that I want to commend again the administration for working on projects such as this. I have worked very closely with AIDS Care and the van. They come to every one of my cut the violences, and they do testing. I've watched and it's interesting to see when, people are afraid to take the test, and I'll go in and take it, or one of the barbers will take it, and then all of a sudden people start really going in the van and utilizing the service. So I think it's a great service. I'm glad that they're partnering with AIDS Care, and I hope that the more we can increase awareness and knowledge on HIV and STDs in the city, it would be great. So again, I commend the administration for continuing such a work through you, Madam Chairman, to the administration.
Thank you. Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-95, acceptance of a grant.
Moved by legislator Ansello, seconded by legislator Quattro. Is there any other discussion? Is there any discussion on this? Seeing none, all those in favor signify by saying aye. And any opposed? Item carries. Next item.
Referral 13-96, acceptance of a grant.
Moved by legislator Quattro and seconded by legislator Carbone. Is there any discussion on this referral? Legislator Cayley.
Thank you, Madam Chair. Through you to the administration. Were we referring to the Genesee Valley Group Health Association, DBA, Lifetime Health Medical Group? Are we talking about servicing other counties than Monroe, or just within Monroe County?
Through you, Madam Chair, just Monroe County.
Thank you. And through the chair, is there any? This is an increase of $27,000. Is there any reason for that in terms of need? Through the chair.
Through you, Madam Chair, the number of cases of what we call post-exposure prophylaxis, the medications that people receive after they've been bitten by an animal, they tend to sort of jump around from year to year, but there really hasn't been a trend of an increase or a decrease.
Thank you. So it's, I guess what I'm getting at, it's sort of serendipitous that you get an increase in funding at this point over last year, through the chair.
Through you, Madam Chair, it appears that it was just a greater availability of funds. Typically, in this program area, we run out of funds from the grant and we spill over into county dollars. We're hoping with this additional amount that won't happen.
Thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-97.
Moved by legislator Carbone and seconded by legislator Valerio. Is there any discussion on this? Legislator Andrews.
Thank you. Through the chair, what other counties are or would be part of this in addition to Schuyler County?
Through you, Madam Chair, it's virtually all of the counties that are, all the 9 counties that are in our region.
And then Schuyler's, through the chair, Schuyler's slightly outside of our region, that's why it's indicated separately?
No, through you, Madam Chair, Schuyler is on a different sort of contractual basis. With the other counties, we have a fixed amount that we charge them. With Schuyler County, they purchase our services off a fee schedule, and it's estimated that there'll be approximately 5 cases with them this year at $2,450 a case. That's our planning assumption. So they're not a big user of our services.
And through the chair, then, the other surrounding counties are all under contract with us?
They're under contract and for a fixed amount based on our experience with them in the past.
Thank you.
Any other questions? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-108.
Moved
Confirmation.
by legislator Valerio and seconded by legislator Daniele. Is there any discussion on this? Legislator Andrews.
Thank you, Madam Chair. I just want to commend Dr. Quattro for his service on this board and representing the community.
I'll second that, so thank you. Any other discussion on that? All those in favor signify by saying aye. Item carries. Next item.
Referral 13-111. Acceptance
Moved
of a
by
grant.
legislator Daniele and seconded by legislator Ansello. And I would like to this time ask why this was put forth through to the administration to put forth to President Adair as a matter of importance to this committee.
Madam Chair, we were advised by the Department of Human Services as soon as they received notice of this grant, which missed the formal introduction deadline for the current cycle, that it was important for us to proceed as quickly as possible. As you can see, the term of this grant began on October 1st of last year, even though we just within the last couple of weeks received formal award of the grant. And my understanding is that the monies that will be flowing to the Center for Youth Services will be used by that organization to hire staff, and they feel it important to get that process moving quickly so that the goals of the grant can be accomplished.
Thank you. At this time, is there any discussion on that? Legislator Lightfoot?
Thank you, Madam Chair. Just a couple of questions here. First to you, Madam Chairman, to the administration. Is this the first year that we're receiving this particular grant? To you, Madam Chairman, to the administration.
Through you, Madam Chair, yes, it is.
And through you, Madam Chairman, to the administration, how many victims do we serve? Through you, Madam Chairman, to the administration, or does Center for the Youth Services, will you anticipate them serving? Through you, Madam Chairman, to the administration.
Through you, Madam Chair, one of the issues for this particular grant is that there is not a lot of research or documentation of young men and women who are experiencing the sexual exploitation trafficking. It's part of the reason that this grant has been awarded to this county. It's a piece of it will be the actual development of a process to identify and to track.
And do you, because of this came in as a matter of urgency, I'm assuming that potentially were there RFPs done for other service agencies other than the Center for Youth Services to be the lead agency on this particular grant, through you, Madam Chairman, to the administration?
Through you, Madam Chair, there was not an RFP process for this. The counties for New York State that received this money were identified by the Office of Children and Family Services based on their estimates of young people who were potential victims. And when we received the award, or the announcement that the money was coming available to us, we received direction that there should be a lead agency chosen by the Monroe County Administration for this as opposed to an RFP process. Second thing is, in terms of this, the way that the objectives are laid out, Center for Youth Services is really the only organization that is poised to represent this type of a grant.
Thank you. And my final question, through you, Madam Chairman, to the administration. It lists here, it says training will be provided to teach the skills and tools necessary to ensure that the child victims are properly identified, referred, and received. Being that, through you, Madam Chairman, to the administration, that we haven't had a lot of data on this, where is this particular training coming from, and how do you properly identify these individuals? Through you, Madam Chairman, to the administration.
Through you, Madam Chair, the organization that is fulfilling that role is the International Organization of Adolescents, IOFA. We are also within this grant, we are creating 2 positions with the help of our folks from Center for Youth, and that's the coordinator and advocate positions. Through those folks and the assistance of IOFA, they will be offering these trainings, gathering the research and data that we need to help these kids that are being trafficked as commercial sexually exploited youth.
Any other questions? Any other discussion? Legislator Andrews?
Thank you, Madam Chair. Through you to the administration, could you just say what the estimate was for the number of young people who are potential victims for our county?
Through you, Madam Chair, the numbers given by New York State, Monroe County doesn't have the numbers. And again, that's why we're participating in this grant, is to discover that data and get that research. But according to New York State, over the last 3 years, in 2010, nearly 32% of young women receiving the services from Center for Youth had reported that they were victims of either sexual abuse, rape, or exploitation. Also in 2011 and 2012, those numbers went to 21% and 23%. So that's the data that we're going with, and also participating with Center for Youth. They were the folks who were able to have this data, dealing with youth 12 to 17. They are the ones that take care of that. As you know, through you, Madam Chair, Monroe County takes care of those youth over 16, and that's why Center for Youth is so important for these 12 to 17, which this grant explicitly says needs to be taken care of.
Through the chair, then, just following up on that, I was going to ask you the reason why Center for Youth was, I think you stated, was the only one that specifically could do this grant. Is that because of the age requirements for it?
Through you, Madam Chair, that is correct.
Thank you.
Any other discussion on that? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 13-112 authorized.
Moved by Legislator Quattro and seconded by Legislator Carbone. And again, I think I'd like to ask to the administration, why is this being put through to President Adair as a matter of importance?
Madam Chair, the main reason for that is, as you can see from the referral, the effective date of these agreements would be April 1st, which is fast approaching. The state has been indicating somewhat vaguely to us that they were eventually going to enter into this arrangement. Only very recently have they realized that we do need formal approval from the legislature to effectuate this new arrangement in terms of early intervention, which is why we presented the referral and asked for its consideration as a matter of importance. As it is, assuming it's approved here today, it will be approved by the full legislature hopefully on April 9th, and I think that extra 8 days will be okay, but the notice was fairly short that we received from the state.
Thank you. Is there any other questions, discussion? Legislator Cayley.
Thank you, Madam Chair. I just want to say that I can see where this would be a matter of importance, having attended a number of IE conferences and hearing a lot of concerns that different, when you have changes in billing and charges and getting paid, this is serves to cause angst, and so I think the faster we can get this going, the sooner people will see that it can work. Hopefully. Thank you.
Any other discussion? Legislator Andrews.
Madam Chair, through you, could I get an explanation of what the new arrangement with the state will be and whether or not that's going to shift any new costs to the county or take any costs away for this program?
Through you, Madam Chair, the main change that's occurring on April 1st is as follows. Formerly, we would contract with all of the providers of early intervention services, and we would pay them. The change that's occurring is now the state is going to be contracting with them, and they will be also assisting the providers in obtaining third-party health insurance. So that's sort of the main change that's occurring. We are not able to predict that there's going to be any change in terms of the dollar impact on the county.
Thank you. So if I understand clearly then, the state will contract with the providers, the state will then pay those providers presumably, and perhaps with some assistance if some of these services now fall under health insurance coverage?
That's, through you, Madam Chair, yes, that's correct.
Thank you. And then through the chair, what is this approximately like a $50 million cost usually to the budget, something around there?
Through you, Madam Chair, I believe it's 12 to $15 million.
Okay. And through the chair, then just for presentation purposes, in next year's budget, would you expect that then this portion of funding won't be there because the county won't actually be receiving it anymore? Through the chair.
Madam Chair, although that detail is not 100% final as of this late date, it is anticipated that Monroe County will bear the full gross costs of the expenditures and still claim reimbursement for the state share.
Through the chair, then, so what does that mean? That figure will still be reflected, is what you're anticipating?
Madam Chair, that is correct. That figure should still be reflected in our 2014 budget and 2013 actuals.
Thank you. And through the chair, is this a program that to participate families apply to the county in order to do so, or will the state handle that portion of it?
Through you, Madam Chair, no, the families apply to us.
And through the chair, that will continue?
Through Madam Chair, yes, the sort of basic clinical portion of the program will remain the same.
Thank you.
Any other discussion on this? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Is there any unfinished business to come before this committee? Legislator Andrews.
Chair, after last committee, I had sent you a letter and requested the administration as well for a copy of the Labella feasibility study regarding the Children's Detention Center.
You did?
I haven't yet received a copy of that study, I don't believe, and so I was wondering if you have.
You did. I believe you received a letter today in your mailbox. I have a copy of it that was sent to you.
If you could indulge me, if it's short, just let me know what it says, please.
Sure. Well, actually, and it just, I actually mentioned about your question to the referral, but I also mentioned that that Commissioner Reed is here tonight, and that she would be glad to respond to any questions you had about what was going on with the the study with the labella. So I think I will give you this letter, but I will also let Commissioner Reed speak on this if you'd like tonight.
Madam Chairman, did we also receive copies of the labella study itself? That's what I requested.
If I may, I'm sorry,
Yes.
Madam Chair.
Yes.
There was a memorandum addressed to the chair and copied in your office. Hopefully you received those copies. If not, I apologize for that. Perhaps Commissioner Reed can summarize what's in the memo, but essentially the study was not completed, and Commissioner Reed can get into the detail. It is expressed in the memo, but the work that was done under the referral, I believe that you're referring to, that was adopted in 2009, was commenced with labella, but was suspended in the year 2010. Essentially because there was a great deal of uncertainty as to which direction the state was moving in with regard to juvenile justice, moving juvenile justice jurisdiction from the age of 16 to 18, which put into serious question what our needs may or may not be in the future. So no work has been done as a follow-up to that referral since approximately 2010. You had also asked, Legislator Andrews had asked the total amount expended. The referral originally authorized, I believe, $242,000 for this contract. The total amount expended to date was about $51,000, and no additional monies have been spent since 2010 because of the suspension of the work. But that's pretty much what's outlined in the memorandum, and Commissioner Reed may want to fill in some additional detail and answer any questions you might have.
Thank you, Mr. Reed.
I guess my first question would be, so for the $51,000 that we did pay labella, what did we get for that amount of money?
Through the chair.
Through the chair.
Through you, Madam Chair. What we initially did was look at if there were some, what kind of site requirements we would have. There are state regulations around what's required for detention facility for juveniles. And we had them initially look at what would be required, what would we need to do to identify a site that would be appropriate for that. However, when it became apparent that there may be some change for New York State with regard to ages, we just stopped it there rather than spend any additional dollars on the study, because what we would need for young people from 10 to 16 versus young people from 10 to 18 is vastly different. So rather than spend any additional dollars, we just asked them to please suspend their work.
Thank you. Did you receive anything from labella through the chair? Did you get anything? No, we didn't get any letter.
Through you, Madam Chair, they did begin a master planning process, but we stopped it. So when you were initially asking, I don't think there's anything particularly helpful in the information that they provided to us at this point, and would not be pertinent to what we might need should the changes occur in terms of the JD18 laws.
So going forward then, if the county were to pursue moving location, depending on what happens with the state law, would you be able to just engage labella again with the fact that we've already authorized the $243,000 for them to continue their work, or how would you proceed through the chair?
Through you, Madam Chair, once the money is appropriated through the Office of Children and Family Services for the study, money continues to be available. So the remainder of what was initially appropriated would be available for us to continue a study.
Thank you. And through the chair, so I understand the $51,000 was paid to labella. Is that accurate for the unfinished study?
Through you, Madam Chair, yes, we paid them for what the work they've done today.
The 51, is that the right figure?
Through you, Madam Chair, it is the right figure.
And thank you. And at this point, at this time, are you contemplating moving the Children's Detention Center through the chair?
Through you, Madam Chair, we are looking, back when we initially discussed this with the legislature and asked for you to consider the initial appropriation, one of the things we discussed was that the center as it currently exists is not conducive to the work and the way we deliver it now, is also not conducive to the population that we have. The population is significantly higher risk population of young people, and our current design is just not conducive to what we currently face now. So yes, we would be interested in moving, but what I'm reticent to go any further until we know what the governor's position would be. I think I might have mentioned at the last meeting that New York State is the only state in the United States that has not taken a position on JD 18, and it would not be in any way fiscally reasonable or practice reasonable to design a center until we know what the position will be for the state of New York.
Thank you. Through the chair, and in your current thinking about this or conversations the administration has had, are you at all considering a site on St. Paul across from DHS?
Through you, Madam Chair, that's not something that I'm in any discussions with regard to it.
And then through the chair, anybody else at the table in conversations regarding moving the Children's Detention Center to St. Paul?
Through you, Madam Chair. Through you, Madam Chair, I'll have to shaking no.
Okay.
Is there any other unfinished business? Oh, Legislator Kaley?
Thank you, Madam Chair. Through you to the administration. Given that sometimes news is last minute, I'm hoping that there's a certain amount of leeway if they do decide on the 18 age limit. But I guess my concern is how, if we are in fact dealing with 18, how quickly can the county respond to that need, and are we prepared in any way to handle that change if it happens within, I've heard 2014 or 2015 floated, which may not be accurate. So through the chair, are we able to handle this if it happens before a new center is built?
Through you, Madam Chair, I believe that yes, we are. We have, our census is certainly lower than capacity in the building, so we would be able to perhaps keep separate the young people that would be coming in. We know what the average is from the sheriff's office at this point, and we could house a certain number of them. I would say to you that in terms of the actual decision and the custody transferring from the Commissioner of from the Sheriff to the Commissioner of Human Services, I believe there would be a period of time. There's certain things that we would be obliged to in terms of keeping the older population separate, and we would need the time to design, practice, and the building to allow for that. But yes, we have thought forward with regard to that. We have begun some conversations with the Sheriff's Department with regard to that as well.
Thank you. Legislator Andrews?
Of the $51,000 that the administration said that we didn't get anything for it. So I think that that's a deliberate mischaracterization, and I think it was inappropriate. They told you exactly what they got for it. To sit there and say that they got nothing for it is pejorative and it's unnecessary. No, that's not what you were told, and I was sitting in the same meeting, so please don't mischaracterize or put words in their mouth.
Legislator Andrews, there is a letter. It does state what was the money was spent for. I know, and
regardless of the letter, Madam Chair, the administration did not go over there and say that they got nothing for their $51,000.
That is correct. Thank you. Thank you.
I would slightly amend my statement. There was something, what I recall being stated.
The statement doesn't be slightly amended. It needs to be ruled out of order.
You can't rule a statement out of order. It's not a question.
Legislator Andrews, do you just have any other questions in pertaining to the Children's Detention Center?
Just to clarify, what I was
Okay.
saying is that essentially they explored the possibility of a few sites and then work stopped. And we spent $51,000
And that's-
on it.
That's not essentially enough. So
They-
it was a deliberate pejorative mischaracterization. And I take an apology.
It was a characterization of, because I asked for a copy of it and was told essentially there's nothing we can got.
Okay. Legislator Andrews, is there anything else that you would like to ask about this question about the Children's Detention Center?
Yes, my question is through you to the administration. How often does this happen? We engage
I
a
think that
study
it was,
and then we spend some money and we
that
don't
was
spend the
answered.
full amount.
That was asked and answered. Legislator Andrews?
It didn't get to the administration.
It was asked and answered, that question was. So unless you have a different question, I'd like to move to adjourn. Okay, thank you. Then being no further business, the March 26, 2013 meeting on Human Services will stand adjourned until April 23rd at 6 p.m. Thank you.